Welcome to Pediatric Associates.
Hello and welcome to Pediatric Associates of Boston. I'm Dr. Christine Kasbarian. I am the newest addition to the practice. I was born and raised in Texas, but recently moved to Austin and I'm very excited to be a part of the family here. We are actually in one of my favorite rooms, the underwater room. I am an avid scuba diver, and so I definitely feel at home in this room here. Today I am going to be answering some very common questions about what happens within the first few days after birth, especially in the hospital, and how to make that transition from the hospital to our practice.
Dr. Kasbarian, one of the big things that we go over in prenatal is really transitioning from OB to us. And so if I picked you as, our baby's primary doctor, would you be the one who would see us in the hospital?
It's a great question. So due to logistics, we actually do not round on infants in the hospital anymore. We actually utilize a service of other pediatricians that are called pediatric newborn hospitalists that will see you right after birth and during your hospital stay. We trust them and we have a great relationship with them, and so they're really great ones to kind of take care of you during that period when you're in the hospital, and then eventually you transition to us whenever you're discharged. And at that point they'll send records over, and then we'll get to kind of see what happened in the hospital.
So if you're not going to be seeing our baby in the hospital, when would you like to see us after we get discharged?
We generally like to see the new babies within 1 to 3 days or so after being discharged from the hospital. Although this is really up to the pediatrician who does see you kind of exactly when they want you to be seen. The good thing is we're actually open 7 days a week where we can actually see you depending on whenever that your baby's born and whenever you're discharged. A lot of times there can be issues like with jaundice in the hospital or weight issues right after birth. And so the good thing is, since we are open and we actually have the ability to do on-site like bilirubin testing and check for weight and things like that, we can see you immediately the next day, which is very beneficial sometimes for patients who do have issues with that you don't have to stay in the hospital for a couple extra days until Monday. That, let's say if you're discharged on a Saturday, we can actually see you on Sunday with that too.
And how do we get an appointment?
So you'll call whenever you know what day you're going to be discharged, you're going to call our front desk and speak with our new patient coordinator. And she'll at that point kind of direct you on what paperwork to fill out and then schedule you for an appointment with whatever doctor is available at that point.
And what if I didn't give birth at the hospital? When would you like to see us?
We still like to see you actually within the first few days of life. A lot of birthing centers offer to follow you for the first 6 weeks of life, but we still recommend, and based on current guidelines, for you to be seen by a board certified pediatrician within the first couple days, just to make sure medically that everything is going well.
So I've heard that there's some things that are going to be done to my baby after they're born. What are those things, and should I accept all of them, decline them? What are your thoughts on that?
So in short, we recommend all the things. All of these things that we do for the babies are actually for their health and their safety. They're all medically backed and evidence-based, and we wouldn't do them unless there was proven benefit, for them to be done. So a lot of times it can be scary when you're, have to make the decision whether or not to do that. There can be differing opinions and Google searches that will tell you differently. But from our perspective, like we said, they're proven to be medically safe and medically necessary. One other thing we recommend is the Hepatitis B shot that is given within the first 24 hours after birth. This is just in accordance with current guidelines and recommendations to give that first Hep B shot within the first 24 hours after birth. The last couple things that they'll do is something called the newborn metabolic screen, which is a statewide screen that we do. The final thing is sometimes they'll take blood, from your newborn just to make sure that everything looks okay with their health, and also sometimes to screen for jaundice as well, which is what they do through a test looking at bilirubin levels.
If we're having a boy and haven't decided yet if we're gonna circumcise or not, and decide in the hospital to wait and then later in the future want to do it, is that something that is done in the office?
So that is not something that we do not perform that procedure here in the office, but we have absolutely no problem referring you to a pediatric urologist who will be the one to perform that procedure.
Thank you so much for answering all those questions. Do you have any last words for our new parents?
Absolutely. So I know that this isn't ideal, right? We've been in a crazy times and our world is kind of been a little turned upside down. I know that if you had it your way, you probably wouldn't have decided to have a baby during a worldwide pandemic. But just know that we're here for you. We are a family. We're here with you every step of the way, even when times get crazy. If not everything that you planned goes according to plan, we're always here to help you and help guide you along in this very uncertain time and the new joys and pitfalls of parenthood.